of welcome back to part 2 of motor development in adulthood, or cross adulthood, and specifically older adulthood. So factors affecting functionality in older adulthood. So this kind of leaves off right from the end of the last one. And when we talk about functionality, we're really talking about activities of daily living. And the two main things are sedentary behavior, or the main thing is sedentary behavior. So the U.S. average older adult spends about 70% of walking time being sedentary. Waking time, not walking time. If you're walking, you're not sedentary. But if you're awake for 16 hours a day, that means you're spending somewhere around 12 of those hours just sitting, sedentary, not moving. Each hour per day of sedentary time means that yields a 50% increase in likelihood of having an ADL-related disability. An ADL-related disability is really inferring that you have something that prevents you from doing things that you would normally be able to accomplish in your everyday life. So regardless of an individual's involvement in moderate to vigorous physical activity, it's an independent risk factor. So it's really not just about trying to be physically active just a little bit part of the day, but trying to be active throughout the day. And so this kind of demonstrates that if it's 1 hour every hour that's increased of your sedentary time, increases your risk of this disability as an older adult. And what kind of physical activity are we talking about? So we want activity to kind of be more than simply just getting up and walking around. We'd like it to be progressive. We'd like it to be focused or specific to functional exercises or balance exercises. And to be at least 3 training sessions per week for at least 10 weeks. So it's pretty important in older adulthood to try and improve capacity as much as we can early on and then just maintain that. So a good intervention may be to try and pursue this type of 10-week program where it's fairly intense, it's very specific, it's focused on functional movement that allows these older adults to be able to reach a new capacity, or at least kind of be able to fill up the capacity that they have, and then going into a maintenance phase where they can then kind of sustain that capacity over time, or at least prevent the overall degeneration of that capacity over time. So when we talk about capacity, physiological functional capacity, the ability to undertake physical tasks of daily life with success and ease. So 2 qualifiers there, success and ease, right? So if you can do something easy, but you fail at it, not really functional, not having a high functional capacity, and if something is successful but very hard, also demonstrates a decline in functional capacity. So what kind of declines do we expect to see with age are due to changing levels of the physical activity first and foremost, and their effects on strength, flexibility, mobility, endurance, and body composition. All things that we see in adults or kids. If the level of physical activity declines, then we see all these other factors are impacted by that. However, in older adulthood, this decline of physical activity and increase in age also can increase the incidence of disease. And what's important is to try and change societal expectations of what should an older adult do with their time? How physically active should they be? It was a long time ago, or not too long ago actually, that we believed that the best thing for older adults to do would be to basically just stay at home, sit, rest, and not try to put themselves in a situation where they may be at risk for a fall. But eventually people have to do something, and they want to be able to maintain their independence. So not having the loss of experience and the detraining of not being physically active has a result of then all of these factors that we talked about. Increased incident disease, increased risk of falls. So if we change our expectations of what it means to be an older adult, and as far as activity levels go, then that can help push the kind of benefits of physical activity and the engagement of physical activity in this population. And just, of course, decreasing motivation to perform. We talked about the kind of attitudes, emotional state, and well-being of seniors is different than that of adults for a variety of factors. But the main thing is that when it comes to motivation, it's not just simply about being able to educate them, but it's also trying to better understand the kind of inherent, kind of intrinsic motivators that people do, why they would want to participate in physical activity as an older adult. So, speed of performance. Running, swimming, these are now kind of interventions we can utilize. So things that we can also kind of identify with decline is that endurance running performance decreases after age of 35, but very gradually. So it's not like you hit 35 and then you see a steep drop off. It's not until age 60 that you then start to see these significant declines. Declines are 3 times greater in females than in males for age group of 35 to 60. Most significant gender differences after age 60. And this could be due to more societal factors. This could also due to some level of physiology. So definitely by 35, adult males have gone through puberty. They develop more muscle mass because they have more free circulating testosterone and androgens. But as they get older and older, we see that essentially, well, males actually die earlier than females. So there's an interesting kind of interaction between overall decline and the actual length of life expectancy between both males and females going from adulthood to older adulthood. And swimming declines with age at 70 years, but less than in running. Okay, so swimming generally seem to be a little bit more friendly than running on the joints of an older adult. Being in water has a certain anti-gravity component to it that relieves pressure on a joint that may be experienced when you're running, which is in gravity. Unless you are on an anti-gravity treadmill, but good luck with that. They're kind of pricey. And significant declines after age 70. So swimming is an activity that can kind of continue to be participated in at a pretty sufficient rigorous level in older adults to a later age than that of running. Or at least that's kind of what we can indicate from this slide. And there's significant gender differences in decline rates for short but not long distance events. And you'll see this kind of also in running as well, that the capability of ultramarathon runners between men and women begins to converge. And so their overall times to complete races is much more comparable in very long distance running compared to short distance running or sprint events. So reaction and response. Reaction time measures how quickly a person responds to a stimulus. So alright, so you see a button flash and then you hit another button, or you see a light flash and then you hit a button. Okay, how long does it take you to see the flash and then hit the button? With training, you can increase or you can decrease your reaction time. So if you were hitting the button at 200 or 250 milliseconds, with enough training, you can reduce your reaction time to something like 150 milliseconds or something like that. There's different types of reaction time that we should talk about though. So simple reaction time is the one that I just described, where some elapsed time from occurrence of a stimulus to initiation of a related response. So it's a one-to-one. I see the light, I hit the button. Okay. Choice reaction time is different. Now I have to choose between two different things, two different responses or two different inputs. So the elapsed time from occurrence of one of several stimuli to initiation of one of several response choices. So say I had a green light and a red light, and I had to depend on which of those lights flashed to either hit one or another button, or to not hit a button. Okay. And this is something that's really identified with these different types of cognitive tasks that we would have done more in class, but there's this task called the Stroop task, or the Stroop effect, where essentially if you were to read a word that said blue, green, red, and the color of that word was blue, green, red, you'd be able to say it very quickly. But if the word was blue and the color was red, and I told you to read the word, you would actually have that delay, because you have to actually inhibit the visual response of the color red from the word and suppress that, and then make the correct response of blue. So you can look this up and try it out yourself, and you'll definitely notice that you have to kind of stop yourself very momentarily to be able to make the right kind of choice. It's the Stroop test. So both decline with age, with choice reaction time earlier than simple reaction time. Choice reaction time requires a much more significant level of kind of cognitive processing to be able to make decisions, to inhibit other decisions, and then be able to move forward with the appropriate decision. Whereas simple reaction time is basically very binary, yes, no, on, off. Saccadic eye movements, exception to A-related declines seen elsewhere. So fortunately, our ability to be able to track our objects through space, or to be able to move our eyes, is still something that is preserved in age. And that's important because you really need your eyes to be able to go to a target, anticipate where things are going, be able to track objects, to be able to dynamically move through space. So think about if that ability to initiate saccadic movements accurately degraded with age, and then you try to drive a car, you'd be very challenged to be able to best anticipate and be able to track and identify things in space, and that wouldn't be good when driving, or just, walking in general, really. Maintaining movement ability. So decline in movement ability does not have to begin as early or be as severe as it is for some adults. And so if you don't do anything, you're basically going to have the greatest decline possible. Compensating for movement decline, however, is something of a mixed bag. So we don't necessarily want people to compensate to the point where things are being degraded in other systems or other structures. And so let's say that, for instance, if someone is learning to come back from a hip surgery or a knee surgery, and they're really favoring the other leg, but they're supposed to be able to start walking again, and they're really trying to avoid putting too much weight on that leg that had the surgery. The other leg now has to kind of take on more of that burden, and the other leg that did have the surgery, that's not taking on those loads from stepping, is now actually becoming detrained. So although they're still accomplishing locomotion and moving from A to B with this kind of compensatory strategy of not favoring the surgical leg, in the long run, this is going to create imbalances. It's going to basically make the muscle structures and joints of the surgical leg begin to become detrained, and it may overload the muscles and structures of the non-surgical limb that is now having to take more of the weight as it goes on. So this is important to be able to understand, when is it good to compensate versus when is it something that needs to be remedied. And so speed accuracy trade-off is one of these things, and we talked a little bit about this in terms of driving. So because reaction time is very slow it's not very slow, but it has declined in older adults, then they have to be able to adopt a strategy, a compensatory strategy of slowing down and really trying to be more accurate and deliberate with their maneuvers on the road. And so they have to shift away from trying to be very fast to being more accurate, because of that decline that we see in aging of a reduced reaction time, and just reduced strength and speed as well of their own system. So setting high performance criteria rather than expecting low performance. So it's important that after any recovery or any type of physical activity, it still needs to be challenging. And even if they don't hit that high performance criteria, that's okay, as long as you tell them that that's okay. That is still important for them to be able to try and exert themselves, rather than saying that to do something that isn't actually creating a stimulus in whatever thing you're trying to rehabilitate or trying to strengthen or improve upon. You have to be able to try and actually apply a stimulus to the muscles that to the muscle or the joint or whatever nervous system to be able to create the change that you want to see, and that's only through challenge. It's not going to happen with just a very low expectation of just kind of going through the motions. It's especially harder in older adults because we don't really see these adaptations happen at the rate that you would in a child or an adult. So they need more training, but they can't do too much training because you don't want them to overuse things. So physical activity, individuals can maintain and improve movement ability well into late adulthood. What you need to do is avoid a sedentary lifestyle, participate in physical activity or exercise programs. Only 20% of the U.S. adults achieve recommended levels of physical activity, and those levels would be dictated by the American College of Sports Medicine, where it's about 150 minutes a week, done about 2 to 4 times a week total. Physical inactivity will become even more common in the future, and at least here they expect it more in women, although I'm not too sure about that because there's definitely been a shift lately about overall the attitudes of women in athletics, and I think it's been a positive shift. But in older adulthood, that is something for the previous generation, might be something to still consider, and their attitudes towards physical activity. So recommendations for healthy adults from the American College of Sports Medicine. Oh, what do you know? Here it is. So yeah, 5 days per week of moderate exercise, or 3 days per week of vigorous exercise, or 3 to 5 days per week of a combination. Time, 30 to 60 minutes of purposeful moderate to 20 to 60 minutes of vigorous exercise. So yeah, you want to get around that mark, however you want to split it up. But it's important to try and have a good frequency, an appropriate intensity. The type of exercise needs to be specific. The type of motor patterns you're using, the sets and repetition scheme needs to be appropriate. These are all things that requires training to really be able to understand how to apply very effectively in an older adult population. There's also a lot of interesting flexibility exercise versus neuromotor exercise. If you haven't really heard this term before, this is something that's still relatively new. So this is exercise involving motor skills. So not so much trying to train muscles to be able to improve the metabolic capacity or the functional capacity as far as like the cross-sectional area of a muscle or the muscle quality of a muscle. These are exercises that involve things like balance, agility, coordination, gait, proprioceptive training, things that are more focusing on kind of overall quality of movements or the ability to produce quality movements. And this is why it's called neuromotor, because these are not things that you need to train in resistance training for to be able to improve. These are things that require very specific type of regimented practice structures to improve. And these types of things can be learned more in the motor learning class that we offer here at UNLV. And so, but it's still very new, especially in older adults. So, major barriers to engaging in physical activity: lacking adequate social support, being able to really participate in a group of older adults is very important, and it probably would also help with a lot of the emotional and affective disorders that we see in older adults. If they possess physical limitations, this is something that's very common among older adults. Having a history or habit of being inactive, it's kind of hard to now change behaviors after 65 years of being sedentary. Having other priorities. Perhaps I prefer to travel and drink and not have to worry about having to exercise and eat vegetables and all that icky stuff. And lacking convenient access to facilities. Certainly, certain facilities are going to be much more prone to a younger audience than others. So the type of facility and then just being able to reach that facility is going to be important. So you think about, we live in a fairly urban area. In rural areas of the US, gyms are not just every couple blocks or things like that. And so to be able to really get access to facilities or equipment that will allow them to do some kind of resistance training is difficult to come by at times. And then just not caring enough, this kind of being apathetic to the whole thing. Exercise is hard, I get sore, I don't really care about doing that, and I don't really care if I die. That attitude is also kind of out there, like I just want to enjoy my final years, blah blah blah. Problem is though is that they say that now and then something happens and then they kind of regret it later. So it's difficult to kind of portray or to educate people on why it's important to at least try to prevent these types of kind of disabilities and disorders from happening now, so that it's something that they have to kind of wrap their minds around for the most part, if that makes sense. So solutions for overcoming barriers to physical activity involvement. Education. So, when a lot of older adults were growing up back in however many decades ago, there were probably a lot of things they didn't know about exercise that we know about today, and it's not like they're taking kinesiology classes to learn about all the things that we now know about exercise and its benefits. So first and foremost, if you interact with an older adult and don't make the assumption that they already know everything that you know. You could tell them like, oh, if you exercise, your muscles will grow. That might be a fact in and of itself that may kind of catch them by surprise, and in a good way. And so trying to give them more information about things that it's already hard enough, with all the kind of gimmicks that were out there as far as exercise goes, to give them the right information and try and then create habits for them to kind of follow the appropriate principles of exercise is very important. And then social interaction, to kind of feel like they'll do this among individuals of their own age and also younger individuals as well, I think is super important, because it creates a whole structure. So it's not just older adults exercise and younger adults exercise. You want it to kind of be one cohesive thing all together, so that it's modified, of course, but it's something that is more of a togetherness to it, rather than just saying like, well, older adults are going to go do their older adult exercise, when all exercise should be the same for everyone, just modified for whatever kind of limitations or exceptions that they have. And so important factors for enabling physical active lifestyles. So resourcefulness, sense of self-help, self-efficacy, self-control. So these are things that are more kind of the soft skills. So it gets beyond kind of a lot of the basic science things, and it really just gets into, well, now that we have all this information, what do we need to do to try and not just educate an older adult, but to also be able to create an environment and a sense of worthiness in an older adult that would then motivate them to engage in this physical activity in a meaningful way. And so if you're 65 years old and you've never stepped in a gym before, it definitely puts you outside your comfort zone, and then you walk into that gym and you don't see any other 65-year-olds there. And you kind of generally know what to do, but you're a little nervous. Think of the first time if you've ever walked into a gym kind of not really knowing what to expect or what to do. There's a lot of pressure there, and it's definitely happened among adults that I've known and seen in my time working in a gym, where they might come in once and then they just find it to be a little too overwhelming, kind of feel very self-conscious that they're not doing it correctly, and then they leave. So it's important to be able to build not only this resourcefulness or the sense of self-help, but also to then create a kind of social network where you come into a space, and this is a space that is going to be friendly, it's one maybe nearby, it's going to have more kind of social activities, it's going to help promote a more positive environment, and it will be kind of an environment that seems very almost natural. So it coming in and seeing a multi-functional, several degrees of freedom type of cable machine is kind of hard to interpret at first bat of like what exactly you should be doing. And so it's very important to think about the differences that an older adult may look for in a gym or a gymnasium or a physical activity area versus what a adult or young adult may be looking for. And so those two places probably don't look the same at first, but hopefully with enough kind of education, enough of the culture trying to kind of move towards being more physically active, then that will change. So I think, let's see here. That's it. Holy cow. So that was the last lecture. I think I had one other one up there before that was going to be about aging, but it was going to be more about aging and different types of disease, and it was going to require more or less material that I would need to try and get to you in a kind of fashion that I'm not capable of doing right now. So this was the last lecture of the series. We're going to have study week next week, and then we're going to have the final. And that's it. It's been fun getting to know you all for at least half the semester. Then the pandemic happened and all kind of went to bed. But I hope you're all doing well. And if you're graduating this year, congratulations. You deserve it. And if you're not, keep studying. All right. See you later.